Fantastic. So very briefly, just to introduce myself, my name's Tom Monaghan, and I work for a company called HaloITSM. We're an IT service management platform based here in the UK, and very kindly sort of invited along today to talk a bit about hybrid working, and also how Halo as an organisation has agilely sort of worked over the last few years to accommodate the massive shifts within the NHS and the public sector, wider world. In terms of sort of my presentation today, what I wanted to talk about was very briefly sort of what is hybrid working. So there's a gigantic shift, as we've been saying. I think a few others have highlighted today. So I pulled up a quote here from Microsoft. I think it's important to realize hybrid working isn't just home and office. It's also working on multiple devices, different devices. So it's all about accessibility, the ability to deliver that same level of service to anyone, no matter where they're connecting to or from. So in this case, hybrid work environment describes any location, being the key bit here, that an employee is working from whilst collaborating with others who may or may not be physically present. This could be a person in a physical office, remote working from home, co-working spaces, lots of shared office spaces now springing up all over the place. As we move on to the next slide, why hybrid working? Why is it important? I think there was an interesting comment earlier about the NHS and recruitment, retention, and how important that is becoming. What a big factor it is for people joining jobs, moving jobs. You'll see here Gartner come out with a statement: over 2/3 of job candidates who are currently working on site would actually prefer to be in that hybrid or remote working model. It leads to a much better work-life balance. I think something that we've all possibly enjoyed over the last few years. I know for myself personally, our job was completely office-centric. We were in the UK office down in Stowmarket, Suffolk, all day, every day. But from the pandemic onwards, that's really changed quite dramatically. A greater ability to focus with fewer distractions, more time for family and friends. For me, a big one. Commuting time and costs. I can take my kids to school in the morning and still work from home. It's a really nice balance to find. Also something that we've found quite interesting, the overall level of IT kind of IT ability, access, IT strength within organizations has changed quite dramatically. A higher level of skill that people just seem to have picked up and worked with. On the next slide here, change is already here. This is something that's already happening, as we've been saying, since the pandemic, possibly before as well. It was interesting, we had seen sort of an uptake in some platforms before that enabled hybrid working. But there are many manual processes in the healthcare sector already being replaced. We've heard about some of the other systems Trickle mentioned earlier, systems designed to replace platforms with a digital version of. The government's setting out that ambitious long-term transformation plan, and we certainly think that there's a lot of opportunity to be part of that. The opportunity to provide sort of the hybrid working for non-clinical staff, it potentially even improves patient safety. Less people involved, less people in the environment, and certainly something that we've found quite interesting as we've been working with NHS trusts. The last point on this slide is laid out in the NHS People Plan. So it's a quote from NHS England. The NHS will continue to commit to offering more flexible, varied roles and opportunities for different types of flexible working. So for us, this messaging, really important in the way we deliver services. And you'll see one of the, I guess, key parts of that, probably something that everyone here is familiar with now, is Teams. It was interesting to join a Zoom meeting today, something I haven't done for some time, but Teams and Zoom, various other platforms, but massive shift with the pandemic, people moving to the Teams platform within the NHS. A smooth transition as it was described here, but a massive transition, 1.6 million co-workers all now on the same system, and a massive opportunity for collaboration and also efficiency gains. I think probably one of the key things that came out of what we were reading into, researching before today's presentation, was that Teams, just as a standalone platform, freed up 2.9 million hours in 6 months last year. And the cost saving for the NHS is just phenomenal. What we've done as an organisation is try to leverage that and become part of that centralised system. So I think one of the key bits here is we don't want to introduce too many technologies. So what we've tried to do is leverage existing technologies that are already within the NHS and embedded, Teams being absolutely core, as we've been saying, and see how we can help to deliver IT service management within that existing solution. We've got a number of integration points, and I'll try and touch on these very briefly in a short while, but we've embedded the entire self-service interface, so how our users can access the platform within the Teams interface. We've got calendar integration, why duplicate things, bots that work for you as an agent and an end user. Those telephone calls, IT service management, it's all about linking systems together, and mobile accessibility. Interestingly as well, ChatGPT, a very recent integration, but again, embedded into the way we're working with these systems. So a very brief look, if I may, just stop sharing my screen for a second and just share another. I can find the right part of Zoom. Let me just end my slideshow for a second and share another screen. So if I can get to Teams, sorry. So over on the right-hand side, I've got Teams. So there's a Teams bot for you as an agent. So as an agent, I've got visibility of incoming messages, and I can simply right-click a message and create a ticket in our IT service management platform directly from it. I can see existing tickets that I've already logged within the system, view details, add notes to it, so it's accessible to me through the Teams interface. We've also got the end user chatbot. So this is where an end user can actually go into our system, start a conversation, and within here, it will suggest, so the previous conversation has ended, would you like to start a new conversation? Yes, we would. So within here, we've actually got the ability for our end users to engage within a platform that they're used to, they're already utilizing the Teams system. And in here, you'll see we've got various options being provided to us. I can ask questions, I can report an issue, or importantly, as it's been said today, you can actually speak to people. Whilst we're moving towards technology, that human touch is still really important. I can ask questions. It will ask me, what questions do you have? And what we're trying to do is guide people towards that self-service, reducing the burden on the ITSM team. So I can say I've got a print issue or something along these lines. And the system will actually then try and suggest knowledge-based articles. This is where you could actually embed ChatGPT. So instead of it looking through internal articles, suggesting things like this, but you'll see it's asking me, is this useful? Yes, it is. No, it isn't. But it's all about engagement with us as an audience. This chatbot is completely customizable. This is just kind of an out-the-box suggestion. But what we've also built into the tool is the ability to capture feedback. I think it's important, as we saw with Trickle, if people aren't having good experiences, that we pick those up very quickly. So within the system here, it's actually going to ask me for my feedback as we're continually trying to improve that journey that we're taking our clients on. So it was excellent, it was acceptable, and we can then take those learning outcomes forward. That's part of our interface. The other side is that we have an end user portal. So if I just stop sharing my screen again, apologies, let me just share this interface here. So this is the agent interface of Halo, so where you'd be logging in to manage requests. If we have a very brief look at a ticket, an incident that's come into our system, this is actually a full transcript of that chat, that interaction that we had. With any system like this, it's all about reportability. We want to get that information back out, so it's really important that that's captured, even if it's automatically closed in the tool. You'll see if I jump into a slightly different incident that we have in the system here, there's integration again for me as an agent. I can call the user directly on the Teams platform, call them on the Teams system, you still get that name, date, timestamped record of exactly when that case took place. So it's all about traceability, but reducing the number of clicks and allowing us to tie these things together. When you email a user from within the system, it can actually send a Teams message back to them. So if the whole sort of comms channel has moved towards Teams as an interface, it's supported and it's integrated into the tool. As you book an appointment, don't duplicate it. It's a two-way sync with Office 365. And it can actually be a Teams appointment. It puts all of those Teams meetings onto the system. So it's a really accessible part of the tool. You have also got the self-service interface where your end users can come in and request things. And something that we've found has really transformed the uptake of self-service is you can actually embed this whole interface within the Teams platform as well. So on the left-hand side of Teams, where you saw sort of calendar, calls, files, things you're familiar with, you can have self-service within that entire system. This web interface loads within it. Really importantly as well, it also works on the Teams mobile app. So if you've got users out and about in the field, different office locations, different hospital locations, they've got the Teams mobile app, they've still got access to service and support. So it's a really robust part of the tool. Those are some of the highlights in terms of our integration. But I think probably the final point I wanted to make is our entire tool is based around a community like we've formed today. With our system, what we have the ability to do is to agilely develop. So our entire tool is based around the feedback, the suggestions that we get from our user base. This is other NHS trusts, other public sector organisations, county councils who've gone through similar transformations. And this is what drives the way we work. So it's quite interesting to see that agile change that was described in an earlier presentation as well. I know this hasn't been a particularly long presentation, but I didn't want to make it into a real sort of salesy pitch. I just wanted to introduce our platform, what we're doing, and talk about some of the sort of exciting changes that we're hoping to bring to the table. Just one last slide, if I may. Let me just share my screen again. So you'll see on here, I know I'm not presenting here, but this is a well-trodden path. So lots of NHS trusts, NHS organisations as well, the National Institute for Care and Excellence, and some of the people on this call today I know are starting to make this journey as well. From our side, I just wanted to thank you all very much for your time as much as anything else, and throw the floor open to questions. I'm sure there's lots of people sort of going through similar journeys, and happy to answer anything that people have got.